Hi guys, we're the Building Heroes Project and today we'll be talking about asthma. Asthma is an illness in which certain substances or conditions called triggers cause inflammation and constriction of the airways, making breathing difficult. So here are some things about asthma. Asthma affects over 23 million people in America, and the frequency in asthma is increasing in all age groups. Asthma is also the third ranking cause of hospitalization among those younger than 15 years old. Here are some triggers of asthma: dust and smoke, air pollution, respiratory infections, fear or anxiety, perfume, exercise, plants and molds, medications, animal dander, temperature extremes, and changes in weather. Here are some prevention measures to help stop asthma. This includes keeping the house hypoallergenic, keeping the home clean, and keeping the air clean. To control your emotions, take long, deep breaths, count to 10, talk to a family member, and do relaxing activities. To prevent infections, wash your hands, clean surfaces with disinfectant, and get vaccinated. Some more prevention measures include wearing the right clothes, staying indoors when there is a high risk of respiratory problems, taking preventative medication, and staying away from dirt, smoke, and other irritants. Some more prevention measures when you exercise is to take prescribed medication before exercising, warm up and cool down, and drink lots of water.
So there are several medications that you can use to treat asthma. And people who are diagnosed with asthma will have a personalized medication plan, and they should take only medications that are prescribed by their healthcare providers. So there are two forms of medication, and it includes long-term and quick relief medication. So long-term medication prevents swelling in airways to decrease sensitivity. It works slowly to control asthma over many hours, and it should be taken daily, even if you do not have signs of asthma attacks. And inhalation is the most common way to take this medication. And then quick relief medications are to stop asthma attacks, and they work quickly to stop sudden swelling. And similarly to long-term medication, inhalation is the most common way to take this medication as well. So there are several different devices that you could use for delivery. So the first one is dry powder inhaler, and this is a handheld device shown in purple that delivers a dry powder form of the medication. And the person who is getting an asthma attack can quickly administer the medication by breathing in to activate the inhaler, and the person does not have to press down on the inhaler in order to receive the medication. But some side effects and downsides may be that the person would need to take a quick breath in order to activate it, and during an asthma attack that might be difficult. And then the small volume nebulizer is the device shown in blue, and this delivers medication in the form of a mist. And the mist is delivered over several minutes, and this is very helpful for people who cannot take deep breaths during an asthma attack. And this is most commonly used for infants and children younger than 5 years old and the elderly, and also for people who have severe asthma. And then lastly, the third one would be the yellow device, which is called the metered dose inhaler. And this sends a measured dose of medication in mist form directly into the person's mouth. So after they gently press down on the inhaler, it will cause a small amount of pressurized gas to enter their mouth, and the person will have to inhale this medication in order to receive the dose. And what are some signs of asthma attacks? So a few signs include the inability to talk without stopping for a breath, trouble breathing, shortness of breath, or rapid breathing, feelings of fear or confusion, tightness in the chest, and sweating. And oftentimes you can hear when someone is having an asthma attack when they have hoarse whistling sounds during their breathing and exhalation, and when they're coughing, laughing, or crying from not being able to breathe. So how can you help? So you can help by recognizing the signs of asthma that we just talked about in the previous slide. So in order to help, you have to know that they're having an asthma attack, and once you recognize the signals, you can act quickly in order to provide accurate and appropriate care. So you can also call 911 once you see that they're having an asthma attack and if their breathing does not improve over several minutes. And then during this entire time, try to remain calm because the person who's having an asthma attack is having difficulty breathing and you do not want to escalate the situation to make it harder for them to breathe. And you can help by having the person sit comfortably, loosening any tight clothing or anything that restricts them from breathing, and helping to prescribe quick relief medication if they ask for help or if you're allowed to help. And then here are some steps to assist with an asthma inhaler. So first, you want to have the person sit up in a comfortable position for breathing. And then you want to make sure that the prescription that they have is under their own name and that it's prescribed for quick relief or acute attacks. And then you also want to check the expiration date and make sure that it is not expired. So then after you check all of these things, you want to shake the inhaler to make sure that the medication is ready to be administered and remove the mouthpiece covering. And then have the person breathe out as much as they can through their mouth. And after they do that, have them place their lips tightly around the mouthpiece of the inhaler and have them take a long, slow breath. And as they're breathing in, you want to press down on the inhaler to administer the medication into their mouth. And after they have inhaled the medication, have them hold their breath for 10 seconds. And after they hold their breath for 10 seconds, they can exhale again, and then you can record the time of medical administration and make sure that you are registering any changes in the person's condition and making sure that you're taking note of any improvements or any decreases in their ability to breathe. And then you can continue to repeat the process of administering medication over the course of a few minutes if their conditions do not improve. And after each time that they take medication, have them rinse out their mouth with water to reduce any side effects. And then call 911 if their breathing does not improve quickly. Thank you. That's it.
Are there any questions? No? Okay.
Thank you.